not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, Living a Longer and Healthier Life, Tuesday, March 27th. Boy, we're ripping through March. That's awesome. It's been a great year so far on the show. We're going to talk a little bit about general surgery this evening and ER and the emergency room as well, but we're going to talk about a med spa that's opening here in Fort Lauderdale that you're going to want to know about because the amount of treatments, aesthetics, and the product line is just amazing. Before I just get started, I want to let you always know that we're on Facebook Live, so you can just type in All County Healthcare, INC, and you can watch us Facebook Live. Another great thing about Facebook is you can see all the shows there, so if you missed anything tonight, you can always go back there. And, of course, the sponsor of the show, All County Healthcare, great local Palm Beach, Broward, and Miami-Dade Medicare certified home agency. So if you have any questions, you can check out their website, allcountyhealthcare.com. Again, all of the shows that we've done on, well, it's Tuesday 6 to 7 now, and Friday 5:30 to 6 are on allcountyhealthcare.com. So check that out. I'll give some information on how to get in touch with them throughout the show. And we have the commercials playing as well. So without further ado, I want to welcome back to the show. He's never been on the air with me, but he's been on the show many times, Dr. Frank Vittimberga. Dr. Vittimberga, welcome to the program. How are you doing?
I'm doing great. So glad to be here, David.
Thank you for coming aboard on this adventure of health. That's what I always tell the viewers and listeners because we're always learning so many new things, and I know you as a doctor, you're always on the latest in medical technology, but to bring it to the public, people just love this show, so I'm really happy that they can get their health information here. Now, you've had quite a career before South Florida and then now in South Florida as well, but I want to talk a little bit about your resume a little later, but I want to get right into the med spa. So this is the Living Well Med Spa, and it's going to be opening in Fort Lauderdale in April. Is that correct?
So we should be open, within the next couple weeks. And so we're located right in Fort Lauderdale, just north of Commercial, 5200 North Federal Highway, and right on the east side of Federal Highway.
Love that area. Not far from right here, the Boca Studio. I mean, that's like on a good day, 30-minute drive, if that.
Well, we'd like to see you. You're welcome to visit whenever you want.
Just shoot right down Federal Highway South. Now, what types of unique experience and expertise? I mean, you study general surgery and you actually practice general surgery, correct?
Yes.
So what kind of, from a general surgery standpoint, what kind of, techniques, experience can you bring to a med spa? I know you were talking a little in the green room about some of the treatments you're able to do with PRP, but it's important to have a certified physician doing any kind of injections, right?
Right. And I think, you bring kind of your whole experience with you no matter what venture you do. And really, I've been looking for finding the next opportunity in terms of, what kind of works for my life and what works for, what clients are looking for. So, I think you bring that experience and, certainly being a surgeon, having that background is useful in terms of, understanding kind of the dynamics of working with patients, as well as, really having experience in working with, injections and working, in tissue management and understanding kind of how the subcutaneous tissues work and how kind of what the structures you're dealing with do. And in that sense, really you bring all that experience in terms of what you're doing. And it really varies, Florida's been fairly restrictive in terms of who's doing injectables and dermal fillers, but throughout the country, really you have to be concerned and question who's giving your treatments. Now in Florida, by law, only physicians or nurse practitioners can actually give dermal fillers or Botox, by their own selves, without supervision. So really, but that being said, you really have to question, the level of experience, make sure you're getting somebody who understands, kind of what you're doing. And that being said, there are certain things that, we're doing that are not, we're never going to replace plastic surgeons in terms of some of the surgical procedures that are going to be done. There's always going to be a need for facelifts or blepharoplasties, doing your eyelids. Those sorts of procedures are not, there's only so much, non-surgical approaches to aesthetics will cure. But what I think we do offer is we bring that whole experience, so it's not just a doctor's office visit that you're getting. We want to bring the whole experience, and we really want to find out what patients feel is important so that they can kind of determine, it's what bothers them. It's not when I look at somebody and say, geez, this is X, Y, and Z, it's really, but it's funny, everybody has their own perception that you'd say, and sometimes it's things that, I would never, I or you would never notice. And then yet by the same token, when it's something that they look at, they wake up every day, they say, geez, that really bothers me. The way that wrinkle around my eye is, or that, whatever it is, so the little veins in my leg that, that bother me. So, all those things that people have. So we're looking to kind of find ways to help people, find their best selves. And so, in that sense, it's not just, that we're going to do X, Y, and Z, but we really want to, find out from the community what areas, they see as important or would fit their needs. And so, one of the areas that really, since we've been going through this process of opening is to have, to look at doing hormone replacement therapies, because that's, there's been a demand, particularly, where I live in Wilton Manors. I've had a number of the guys ask me about, doing testosterone replacement therapy and, looking at that as a treatment, because we're looking at kind of what, overall wellness and really, kind of giving a better, kind of holistic approach. And really, it's a lot different than, surgery in some ways too, because, with general surgery, you're doing, most of it's people who need surgery now and they don't have a choice, or they come to you because they don't have, a choice as to, it needs to be done. And so this is kind of completely different, where people are coming and saying, they do have a choice. And so you've got to be able to provide that, the quality of the treatment and also the quality of the experience, so that people are satisfied and they keep coming back.
Definitely, yeah, it's definitely elective, which, as in your career, when you were a general surgeon, yeah, those are things that had to be done, or else, some of them I imagine were life and death. So this is a much different, more elective. And I like some of the points you just made there. Well, all of the points, but some of them were really right on. Obviously, we're here in South Florida. I mean, image is a lot. I know I'm in the PR world, and it can be tough. You gotta dress and play the part sometimes, just to get it done. So image is huge. We're always on the beach. We're in the water. We're on the boat. So as well. And then you made a great point. We are the best expert of ourselves. We're seeing ourselves in the mirror every day. And if you're not happy with yourself, I mean, that can cause a whole bunch of different problems, make you kind of second guess as well. And if it's something that, you have the means to do, why not, And the third, baby boomers. Wow, they look great, but they are aging at a fast rate. And obviously they're working longer and want to keep, that image as well, keeping looking as good as they can. So I think it's great. And I'm going to give out your website a bunch of times because I think it's great, livingwellmedspa.com. I love how you put the prices on there, because I think as a consumer, I mean, that's what we're looking for. We want to know on there, you know?
And I do think that's important. I think that, having transparency in terms of pricing is very important. I was actually just over at had a doctor's appointment. I was talking to the nurse when I was there, and she said, she went to a provider who, and she said she didn't even know what it was going to cost until it was done, and it kind of came as a surprise to her. And so, I think that way we can work with people. We want, kind of to provide, a reasonable deal, and really to make it so that people understand up front what the pricing is and what it's going to cost, and again, that being said, we want to try and make it very accessible and try and pass along the opportunities we have in terms of pricing, but it is a competitive marketplace, and there's certainly fixed costs that you just that limit kind of how low you can go. So
yeah, especially in South Florida. I mean, it's a competitive market. But I want to tell you, I've never myself gone for that kind of elective treatment that you have on your website. And there, you got to take a look at the website, folks. There's so many different areas of interest. Dr. Frank Vittimberga is introducing at Living Well Med Spa. But I thought it was all reasonable, to be honest with you, on my salary. I thought it was very reasonable. So I was a little surprised, to be honest with you.
Right.
So that's great.
And, again, I think it depends on the treatments, in terms of how durable they are. Generally, when you're looking at, at neurotoxin treatments with botulinum, generally around 3 months is a reasonable expectation in terms of how long that's going to last. Essentially none of the treatments are permanent that we're going to be, doing, but they do, the dermal fillers tend to have a lifespan of 6 to 9 months in terms of, how long something like that would last. And so those are basically, they're hyaluronic acid, which is a glycosaminoglycan. They're kind of naturally occurring in your skin, and so they get absorbed eventually over time. But they help kind of to replace what your body has, normally, as we age, we tend to have decreases in the subcutaneous fat, in the glycosaminoglycans, and in the collagen levels. And so a lot of the treatments, in terms of facial rejuvenation, and are geared towards how can we re-elevate those, those kind of the textures in your skin and give it more of a younger looking appearance. And so to do that, a lot of it, when we look at things like doing a chemical peel, really that kind of exfoliates the top layer, the corneum stratum of the epithelium. And so once you can take that away, then you have, the ability to access the, the lower layers to get, the treatments in there. A lot of products that you'll buy off the shelf, if you go to your local pharmacy or you go to, your local department store and look at the products, the formulations, make it difficult for them to get where they need to be. And so in the preparation and, oftentimes the concentration are just not kind of what you need in terms of a cosmeceutical, in terms of being able to really penetrate and rejuvenate the skin. So, things like facial peels, the Dermapen, the microneedling, right now we'll be using the Skin Pen. The Skin Pen is the only FDA-approved microneedling pen, and what that does is it creates channels in the superficial layers of the skin to allow for treatments to reach down, so you can replenish the collagen or replenish the glycosaminoglycans, and or to get antioxidants into the lower skin levels so that they can kind of help rejuvenate the skin.
We're talking Botox, cellulite therapy, chemical peels, dermal fillers. Got that one. And then a whole bunch of else with Dr. Frank Vittimberga here. He's opening a Living Well Med Spa in Fort Lauderdale, right on Federal Highway. So right in our listening area as well. 954-637-0750. We're going to take a quick break, and on the other side, talk a little bit about vitamin injections with Dr. Vittimberga on the You and Your Doctor show.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back on the You and Your Doctor show, Living a Longer and Healthier Life, with Dr. Frank Vittimberga. He's opening the Living Well Med Spa in Fort Lauderdale, and I do have the address here. I know you gave it out, Doctor, but I want to give it out. 5250 North Federal Highway in Fort Lauderdale, 954-637-0750, or any of the information I'm talking about is on livingwellmedspa.com. Dr. Vittimberga, we were talking before the break a little bit about injections, and I wanted to just say to the listening public and the viewing public, I mean, to have someone do an injection into your body that's not certified, not medically trained is not a great idea. I'm in PR and the news now since 1999. I've been a professional writer, and I've read so many stories in South Florida about people injecting stuff into other people not being certified. People have died from getting bad fillers, from the Fix-A-Flat that was used in some types of butt enhancing surgery as well. And it kind of sounds funny, but it's not, because if someone loses their life, you definitely want to always have a certified physician do injectables, or someone certified in the medical field. Right. And here you got a general surgeon with competitive prices here in South Florida. And some of the other injectables you do, and I know this because my mom actually takes a B12. That's important for baby boomers, because sometimes there's a B12 deficiency, right? Right.
And so B12 helps to create red blood cells, and it's important. It usually gets absorbed in the stomach. We've seen over time there's been increasing needs as people get older, that they don't absorb it as well in their stomach, and so there's a demand. There's a need for it, and so people will get what's called pernicious anemia if they have a deficiency in vitamin B12. And so, but one of the things that we see is a lot of people have had weight reduction surgery because they have a reduction in their stomach and the absorption capacity in that area for the B12, where it's normally, you normally have the factors that help absorb it. You lose that. And so people, tend to have, the risk of being, having a B12 deficiency. So certainly it's something that not everybody needs it. I mean, I think it's there's people that, will have a B12 deficiency. There's people that are just fine. But, again, I think reliably getting B12 injections, make sure that you're getting the level that you need.
Mm-hmm. And you offer a B12 package. That's neat for the whole year.
Oh, yeah.
That's fantastic. So, once a month?
Yep, once a month. So, yeah, it's, as I said, it's really, for the people that need it, it's good to get on a regular schedule. It's kind of like taking your medicine, every day, but with, B12 injections, it's kind of, once a month is kind of a good treatment schedule.
Now, if people know it, do they have to be referred by their primary care? Or can they just come in if they've already been told if they've had it?
Oh no, they can come in. You know,
okay.
And again, we can
Nice.
we can work with their primary care doctors too.
Oh yeah, definitely.
So, but again, I think that we want to look at kind of again bringing in the treatments that are people are looking for that really can help them kind of feel kind of overall improve their wellness. And so we see that in terms of IV therapies are becoming more and more important, and looking at kind of where people have deficiencies. And again, I think that there's a balance in terms of a lot of, if you take too many vitamins, they don't necessarily do any good. But again, a lot of vitamins that you get in pills that are, over the counter at the pharmacy, again, they don't necessarily get absorbed into your system and get, passed out, excreted. So you're not really getting the benefit of those vitamins, even if you're taking them. And that's the reason why, you can take all the B12 you want, and if you're not absorbing it correctly, you need to get it in a form and through a mechanism that you're going to be able to get the true benefit of it. So even if you take the same level of B12 by mouth, and it's not going to be effective. So
never thought of it like that. That does make sense though. And then this is actually what I've been waiting to talk about is actually the facial skincare products. And people may find that surprising, but I've had acne my whole life. I mean, all the way back I can think of when I was on Accutane and Retin A, and that stuff was so hard on the face and system. You go out in the sun, you just get very burned and very bad.
Yeah.
And then I got into the Stridex and Clearasil, which I still use today. Kind of just because I like to see what is the dirt come off my face after a long day. I'd like to see that the Clearasil picks it up. You look at it, like you hold it to a white piece of paper. Oh my, that was on my skin. I'm glad I cleaned my face. But then you go outside in the sun again, and it just tears up your face because of that whatever acid's in there. So what can you offer in terms of cleansers, exfoliators? I see there's all kinds of options on your website, and they're again very affordable because these sizes are much bigger than what I'm getting at the grocery store.
Yeah. So again, I think that the first thing is looking at kind of is the treatment that you're going to get going to be effective, and so making sure you have it in a concentration that's high enough and in a delivery system that's efficient enough. So I think that you want to get into a skincare regimen that is kind of a regular system that works for you. And so again, I tend to have the same problems when I use stronger cleansers that for one it really tears up your face, and for two it does make you photosensitive. So I think you want to get into using a cleanser and a toner that work well with your skin, and then certainly once you've kind of cleansed off and exfoliated the skin, then you're able to use some of the products that will be able to have a deeper impact. And so vitamin C serum is one of the things that helps. It helps kind of decrease any extra pigmentation you might have. As we get older, we tend to develop age spots, and it helps to fade those. And then we certainly as you said on our website, we have a lot of regenerative products that again are all aimed at improving the collagen and the glycosaminoglycans in the dermis of the skin, and really helping to rejuvenate the skin. And then again the other thing that we offer is really the most important thing probably out of all of these things is sun protection. Skin care with sun protection, because ultimately, a lot of what we see, particularly in South Florida, because we have so much sun exposure, is that, you get skin damage over, not over just months or weeks. It's over years and years of skin of being exposed to high levels of UV radiation. And so it's really important to have good, SPF protection, so that when you go out in the sun, that you're not damaging your skin anymore, and that all that good that you're doing in terms of doing treatments on a daily basis is really really being saved, and you're not making backwards progress. And again, I think that the other issue is that in this day and age, as we live older and older, the problems with skin cancers and really developing basal cell carcinomas or squamous cell carcinomas or even melanomas, really are becoming more and more of an issue. And so I think we've got to look at it. We want to take care of our skin, and then we also want to protect it from the sun and possibly, some of these cancers that can develop, years down the road if we don't take proper care of it.
That's a great point too. I've had listeners will know this. I've told this story a few times. Driver's side melanoma. A peer of mine, a friend of mine in the PR business, TV business, got it from just driving to work the same way every day, and actually had it cut out, and it took a while to get it out. I thought it was like a 2-year process. I mean, that thing was just like a lot of his cheeky. He's doing fine today, but when I saw that, wow, we got to be careful. And the second part of that point, I'm from Jupiter, Florida originally, and I'm one of those, in my youth, I spent so much time in the sun, fishing, spear fishing, on the beach for the first 25 years of my life, and never even thought of sunscreen until I got maybe in my 30s.
Yeah, and again, it was, in my generation, and probably to a lesser extent your generation, you're younger than me, but it was, we were the Bando Soleil, everybody should be, as dark browns as they possibly could.
Tanning oil?
The baby oil.
Yeah, the baby oil.
The little reflectors that people had. So, again, I think, hopefully, we're learning from our mistakes, and, again, it's not too late to protect your skin, and certainly, we want to pass that on to, the younger generations as time goes on, in terms of, being able to have that skin protection. But, what you were talking about, driver's side skin cancer or driver's side melanoma, having, when you're sitting in the driver's side of the car, your left side is exposed to the sun, and much more than the right. We see it in truck drivers particularly, where that was really a very prevalent thing to see, where, I treated melanomas for years and years and years, and, saw a number of truck drivers who come in and, invariably it's on the left side. So
unbelievable. Yeah, I never even knew that term until a few years ago, and yeah, it really happens. So we're here with Dr. Frank Vittimberga. livingwellmedspa.com is the website. Ton of information there. 954-637-0750. Located right in the east side of Fort Lauderdale. Great location. 5250 North Federal Highway, Fort Lauderdale. And I know actually Dr. Vittimberga from his days that he's been a chief medical officer here at, I believe, 2 institutions in South Florida alone, at Florida Medical Center most recently. And where are you at? Jackson most recently too?
Just in passing.
At Jackson too. As well. And we're going to have Dr. Vittimberga here for a little while longer. If you want to call in 1-888-565-1470. I still have so much to talk to him about. But if you have any appropriate questions, we'll get them on the air. Or like I said before, check us out on Facebook Live. I've had some questions come in there. I see the viewers on the screen right now. So just type them in. And like I said, if they're appropriate, and, the doctor can talk a little bit about the issue, that'd be great as well. One other thing I want to talk to you about, because I was first described as someone said, check out Dr. Vittimberga's Facebook page. He's opened a living med spa, and I took a look, and the first few words I saw was anti-aging and rejuvenation. And that's what you're obviously focusing on. But that is so important right now, again, with this baby boomer population as well. And I never really looked at anti-aging medicine until I got near 40 years old, to be honest with you. And I wanted to ask you a little bit about it now. I first was, and correct me if I'm wrong, but I first saw anti-aging medicine in the form of, and it's on the tip of my tongue, and it was used in professional sports, is that hormone, that growth hormone that was used for a while. I don't know.
Creatine?
Creatine first in the gym.
Yeah.
And then it's on. I'll think of it. But tell me a little bit about what you offer for anti-aging, because I see on here stem cell therapy gel. Really? That's available?
Yeah.
Wow.
So we have, we do have stem cell therapy gel. I think that there's
human growth hormone. That's what I was thinking of. HGH.
Yeah, and so that HGH is a normally occurring hormone in
the body.
In the body, and so again, it's kind of, as we age, we tend to have variations in terms of kind of what our hormone levels are, and they tend to trail off. Particularly that's what we see in terms of testosterone levels, and in terms of hormonal women with their estrogen levels. And again, we also have to put that in the context. And again, this is where kind of background in general surgery comes in, because we spent years doing estrogen replacement and said this is the best thing since sliced bread, and just giving it out, and then found out that we did see an increase in breast cancer and uterine cancer with those sorts of treatments. So you have to be, these are not panaceas, and they're not to be treated lightly. But I think at the same time we want to kind of naturally be able to recreate certain things that your body is leading you to not feel as good as you possibly could. And so whether that's looking at hormonal testosterone replacement treatments, one of the areas that we're really interested in is platelet rich plasma, where basically it has a lot of the hormonal factors. And so what you do with that is you take blood out of the patient, out of the person who's being treated, so it's their blood. There's no risk of kind of anybody else's blood. But what you do is you spin it down in a centrifuge, and you take the platelet-rich plasma, which is the layer of plasma that doesn't contain the red blood cells and some of the other components, but it's kind of concentrated in terms of the having the ability to have those growth hormone factors. And there's been a lot of research into injecting that into joints to see if that helps rejuvenate joints, and that's not an area that really we've looked at, but certainly in terms of facial rejuvenation, working with platelet rich plasma in terms of the the treatment in terms of microneedling it into the skin, to really bring those growth hormones down to the level of the the dermis where you can get facial rejuvenation and bring those factors where they need to be. And so again, that's what of course Kim Kardashian, the Kardashians are kind of a curse and a blessing to a lot of this stuff, because they certainly brought it to the attention of the mainstream, but on the other hand, a lot of it is kind of it sometimes it gets overhyped. And so she had what they call a vampire facial, and that's a trade name of in terms of the treatment, but it basically they use that plasma and inject it into the face. And so looking at those sorts of treatments, how can we create kind of looking at all the things. It's some of it is just kind of purely kind of looking at cosmetic approaches in terms of it used to be people, when we first started giving Botox, they wanted to look like they were paralyzed in their forehead. And most people nowadays want to look natural. They want to have they want to look younger. They want to have relaxed facial musculature, so they don't have the wrinkling, they don't have the 11s, they don't have the crow's feet or the furrowing of the brow. And so all those things are tend to bother people. But at the same time, they don't want to look like somebody who's kind of a plastic surgery nightmare. They want to look like a natural person who's really kind of looks like kind of you, but without the things that bother you.
Yeah, it's definitely evolved. And nice with the Kardashians there. They were influencers. That's the word we're looking for in PR. Influencers. So, no, but that is a good point. And what I like about it, to be honest with you, is you're using your own blood. It's nothing from the outside. Like, it's your own blood spun down while you're in the office and inserted back in. What could be better than your own, your own makeup, your own chemistry? I mean, what could be better for the body than that, than introducing something else?
Right.
So
and and again, I think that again, as you mentioned, when we do, when you do need to use products that are not, from yourself, but again, the products, it's important to get, that we get, from Allergan and from Revenus and really the Galderma, really looking at the brand names. And we're fortunate now that we live in a time where there's choices in terms of the providers of those substances, and they all work, whether it's dermal fillers or neurotoxins, they work in similar fashions, but it does give us options in terms of different treatments and different opportunity for different pricing. So
fantastic. We're here with Dr. Frank Vittimberga, Living Well Med Spa in Fort Lauderdale. Dr. Vittimberga, I want to ask you if you'll be nice enough to stay for one more segment.
Oh, sure.
I'm sure I didn't know if you needed to run and had another something on your schedule. I was waiting for the ER doctor to call in. He may have got tied up. But let's take a quick break on the You and Your Doctor show, and we're going to talk a little bit more about Living Well Med Spa with Dr. Vittimberga on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Really, so.
And we're back on the You and Your Doctor show with Dr. Frank Vittimberga of, I just want to get this right here, I got it there. I was saying it right, Living Well Med Spa, a new anti-aging and rejuvenation beauty spa in Fort Lauderdale, 5250 North Federal Highway, 954-637-0750. Dr. Vittimberga, you were telling me a little bit about the build-out. I mean, this is a really nice place that you're opening.
Oh, yeah.
Tell us a little about it.
So, well, you know, it's probably, we're going to grow into it. So it's definitely, it's a good space. It was actually, it had good bones to begin with and good structure. So you know, it's great for me because, you know, not only do you get to play physician, but, you know, I get to be, you know, electrician and plumber and carpenter and a little bit all that too. But really the place, you know, like I said, it's you know, really you want to feel like you're, you know, getting the full experience in terms of coming in and really feeling like you're in a comfortable place. And so, you know, really we're really trying to make it feel like, you know, a good experience for the patients and really so it's more the whole experience. And so you know, we have put in a lot of work on it, and you know, we're real happy with how it's looking. So, you know, we're gonna have you down there soon.
Definitely, and we'd love to come down. Maybe we can even bring the whole show down there. I know there's something in the works with Freddie, the producer, so hopefully we can take the show on the road one time, maybe for your grand opening. I mean, I know it's close. So, yeah. But Dr. Vittimberga, I want to talk a little bit about your resume because it's one of the most amazing resumes that I've seen. I know it's on your website, but you are a graduate of Harvard University and the University of Massachusetts Medical School. So that's UMass's medical school. I'll tell you something. People from Boston and the New York area, I've met people from all over the world. Some of the smartest people I've ever met in my life. I don't know if that starts in grade school and just goes all the way up, but you got great schools there and great colleges, and you went to the best. I mean, you went to Harvard and UMass, completed surgical residency and 3 years of research as well. MBA, you have an MBA from UMass at Amherst.
Yep.
You own your own private practice in Dallas, Texas, where you served as Chief Medical Officer of Methodist Charlton Medical Center. Wow. And after accepting the chief medical position down here. You moved your family down to South Florida. We're so lucky to have you. No, really.
Yeah,
I mean it.
My kids were actually, they're big sailors, and so we were actually reached the point where we were traveling to Miami very frequently, and so we reached the point where we said, this is kind of where we want to be, and so really, we've been very happy being in South Florida, and really just, it's been the right place for us. Although my older son, who's a sailor as well, he's a freshman over at Trinity College in Dublin, Ireland. So,
neat.
So but he's sailing over there. Although he complains, he did say, in the middle of the winter when they were out sailing that, he was thinking about coming back to go to University of Miami, but he worked through it. So
nice. That's gonna make him tougher, right?
Yeah, I think every time he says that it's cold up in Dublin and they got an inch of snow or something, I just tell him it's not as bad as Boston is right now.
Oh, yeah. I mean, Boston's had a tough few years with the winter up there.
Oh, yeah.
And my mom was transferred from down South Florida to Hartford, Connecticut for 10 years. Whoa. I mean, between New York City and all the way up through Maine, Nova Scotia, you get some wicked weather. Yes, that's the right word.
Wicked.
Yeah, wicked. Nor'easters. Though, I got to go 10 times to Fenway Park when she was up there, though.
Wow.
And her company would get the same seats every time. I've never sat anywhere at Fenway Park except near Pesky's Bowl, which I don't mind. No. That's the only place I've ever sat in the whole park. I'm actually going back up September 6th. I'm seeing Pearl Jam at Fenway, so it's going to be pretty neat. Yeah, I'm a lifelong Pearl Jam fan, so finally got the tickets, so now I just got to figure out how to get up there on Labor Day weekend. Haven't bought the tickets yet, but anyways, that's a story for another day. Well, I want to thank you again so much for coming to the program. Definitely, everyone needs to check out your Living Well Med Spa, because for aesthetics, treatments, product lines, you are the person to visit. I mean, the amount of information we just got done on the 40-minute show is amazing. And I'll tell listeners, I'll stand by this. The prices are really competitive from what I've seen in South Florida. So I think everyone should take a look and come on down. But again, thanks for coming on the show. You're always welcome. I just want to let you know that as well. I mean, we talked about everything today, from peels, fillers, injectables, anti-aging medicine. I didn't get too much into the human growth hormone. I mean, you told me a little bit about anti-aging medicine, but is that something that's available?
That probably, it certainly is. It's not really our focus. So,
okay.
So, we're going to look at more, kind of
beauty, rejuvenation,
but also,
anti-aging,
and probably, more estrogen, testosterone type replacements, rather than the actual, those sorts of hormones. So.
And the stem cell, that stuff's amazing too as well.
Absolutely.
I'm just looking at the list is amazing. Well, I want to thank you again for coming on the show. Again, it's Living Well Med Spa, 954-637-0750. Grand opening is right around the corner.
Yep. We check our Facebook site or our website. We'll have the exact date up, and we're going to have a little bit of a celebration, and certainly looking at having discounts. So it should be some good deals to be had.
Oh yeah, get those introductory discounts. You can't beat those, and you got some great plans. I know we talk a little bit about the B12 annual package, but what a time to get in to the spa right when they start and get introductory discount. Their number is 954-637-0750. Remember, check them out, livingwellmedspa.com. We'll be right back on the You and Your Doctor Show.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need. And he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back, and we have a treat for you. We're here with All County Healthcare Incorporated's Vice President, Lou Biasi. We're going to talk a little bit about COPD. I know this is the third largest killer in the U.S., I believe, right now. Chronic obstructive pulmonary disease.
Right.
Go ahead, Lou. Tell us about it.
David, explain a little bit about COPD and what's happening today in the hospital settings. Well, COPD, as you know, it's a non-curable disease, and who has it out there? You know, I know you're having a tough time, and you tried everything. You're probably on an oxygen, and you're trying to get some relief. But what has happened in the last 3 or 4 years have been a device called an IPV unit, interpulmonary percussion air system. And what that does, that helps alleviate the mucus that's caught within the tract that you can't bring up a lot. And if you're in a hospital, and what happens in most hospitals right now, the readmission rate for COPD is tremendous. It's costing Medicare fortunes and fortunes of money. Medicare has asked the hospitals, how can we basically stop some of these readmissions? And most of the readmissions are caused from respiratory disorders, like COPD. Well, 5 years ago, we made a major investment in a unit called an IPV unit, which is the same unit that they use for children with cystic fibrosis, or they use in the hospitals as you try to get cured, so you can be out of the hospital within a certain period of time. What happens, they discharge you, and within 15 days, again, you're back into the hospital. All County Healthcare, we have done studies on it. We have the only company right now in South Florida that has 5 of these units available to bring into the home so that the patient now can get to some relief from his problems of respiratory problems. We've had a situation where we had an 80-year-old man who was on oxygen. We gave him the treatments. He got 7 treatments the first week, 4 treatments the second week. And what happened, David, it was amazing. He went out swimming in his pool, came home, made love to his wife, and the wife said, I want to buy that machine.
She wants it in the house.
But there's many stories like this. What's happening? We've done studies on it. And if you have that problem and you think, and your homebound status, ask your doctor, hey, doc, I'd like to try this IPV unit that All County has. Is there any way you can order it for me? It's being ordered. Now, we went down and we presented this to Cleveland Clinic. The pulmonologists down there, Dave, were so impressed. They said, we want this in our outpatient pulmonary center. We put it into the outpatient pulmonary center. People have been using it, and they find tremendous relief, right? Florida Medical Center has called us. Can you help us stop the readmissions? So all the individuals that are out there, if any case managers are listening right now or any doctors are listening right now, give this, if you have a COPD patient who's chronic and basically is in and out of hospitals, give this protocol a try. I think, and once you try it, you'll see the relief. We just did a patient, and if you go to our website, there's a Mr. Khan who has written something on the website, and it indicates that we tried it on his mother, who was supposedly supposed to go to hospice. The doctor wanted to go to hospice. She said no. She wanted to see her granddaughter get married. So the doctor ordered a nebulizer. We ended up putting the IPV unit to work with her. And before she went back in 2 weeks, and the doctor called me, said, I couldn't believe it without my own eyes. She said, if I didn't see it with my own eyes, I wouldn't believe it. I wouldn't believe how she tremendously has improved. Her oxygen levels improved. Well, she went to her granddaughter's wedding. She danced with the granddaughter. And, she finally succumbed about a month or two later. But the IPV unit kept her alive, right?
Wow.
There are many stories like that, right? We have a lot of stories like that. So we're talking about specifically one thing that All County does different than any other agency out there. So if you're suffering from respiratory or you're suffering from any kind of COPD, and you're a frequent visitor in and out of the hospital, tell your doctor you want to try this particular therapy, right? And I think you'll find some great, tremendous amount of results for your benefit that, hey, at least I can get up, walk around, maybe get off the oxygen, for a while, see how this thing works.
Quality of life.
Right. And we've done studies. And if you go to our website, www.all County Healthcare, David, if you go to the website right now, if you go to that website, you'll see some of the studies. There's a study that we did at the, I think it was a veterans clinic out of Wyoming that was having major problems. Mm-hmm. And the results were just amazing. We did studies when we got the units. We've done studies. We kept patients out of the hospital for over 12 months that were going in within 15 days after being discharged. We'd be back into the hospital in 15 days. So when you look at all these programs, right, and, everyone has a certain program that they have, home care. Everybody is fighting for that home care business. But this is something that we made a major investment in. Hundreds of thousands of dollars we invested in these units where no other home company has them or can have them because we have exclusivity on them. Mm-hmm. And to be honest with you, it's going constantly. The 5 units are going out there constantly. We have a trained pulmonary team, respiratory pulmonary team, that goes out and applies this. So, again, that's what we want to talk about. We want to talk about trying to keep you out of the hospital, try to keep patients out of the hospital. I don't know how many millions and millions of dollars it's costing right now, Medicare, just in the state of Florida, for the readmissions for COPD, right? And we have all the statistics. We have a book with every single hospital who has the statistics. We know what Delray Hospital has. We know what Boca Community Hospital has. We know what Northwest has. All the local hospitals have a tremendous amount of readmissions within 15 days. A friend of mine, 88-year-old person, she had pneumonia. She was in and out of Boca Community, I don't know how many times. Within the first month, she was in and out of Boca Community at least 4 or 5 times for 3 days, 4 days, 5 days. It's cost the hospital about $30,000 to $60,000 for each patient that's readmitted. The average stay is 3 to 4 days again, okay, before they get back up and get back out. Well, 15 more days, they're back in, right? We want to stop that. We want to stop that reoccurrence. So if doctors are listening, patients are listening, family members are listening, if young people are listening and you know your dad or you know someone that has COPD, tell them to call. Call All County Healthcare. We'll go to our website. If we have to, we'll give you all the information. Our phone number over there is 954-717-7027. Call, talk to one of our case managers, explain to you the problem. We will try to set it up with your doctor to see if we can get you primarily onto the program. If you are homebound, you're covered under Medicare. Medicare is covered under Part A. There's no charge. Home care is no charge. You've been granted that right under Social Security Reform Act. It's covered under Part A. So there's no charge for home care. People might think, well, there's a charge. How much are you going to pay for this thing? As a matter of fact, each person that gets this treatment, it costs All County Healthcare $100 just for the mouthpiece. Mm-hmm. So, again, if you have that problem, you have any respiratory problem, you, family member, your dad, your mom, your aunt, someone, call All County Healthcare, 954-717-7027. Go to our website. Look what people have written about the treatments they've received and how well they've done after the treatments. Our website, again, David, is
allcountyhealthcare.com. I'm actually on it right now. There's a ton of information on it.
Tremendous amount, and there's studies are on it, too. So if you're a doctor and you want to go to our website, or your case manager, go to our website, they talk about trying to stop these readmissions. We're the only company that has it, so they should be, let's be realistic. If they really want to stop them, they got to be calling All County Healthcare.
Mm-hmm. You actually have a COPD care tab there that has a whole bunch of information: bronchitis treatment, pneumonia treatment, emphysema treatment as well.
And you see the respiratory team is right there.
I see it, and you have a respiratory therapist on staff.
Ed Salazar, he's been a respiratory therapist for 40 years.
That's fantastic.
Ed's probably one of the best around, right?
So
he basically, again, he engineers this whole program for us to make sure that the patients get the right care.
Well, thanks, Lou, for jumping on the You and Your Doctor Living a Longer and Healthier Life show. And have a good night, South Florida.
All right. Thank you, David. That's it.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its